Hey everybody, it is Nurse Eunice with Florida Training Academy, and in tonight's video, we're going to be reviewing the Headmaster CNA Practice Test. And I cannot wait. So as we do in each of our videos, we will give you a few seconds to receive your notifications, and we will get started shortly. To everybody who's already in this chat area saying hello, welcome, and happy Wednesday. All right, so I'm often asked, what is the difference between the different exams? In Florida, we have Prometric. In other states, we have Headmaster. At the end of the day, all of the certified nurse and assistant examinations are based off of national standards, not off of state standards. So whenever you ask, hey, Nurse Eunice, can I use your test if I am in New York, if I'm in Ohio? The answer is absolutely correct. However, once you get through practicing for your test or attending your school, you have to go take your test through a local agency. And so one agency is called Headmaster. And so the Headmaster CNA Exam is a competency-based evaluation designed to assess the knowledge and skills required to provide high-quality nursing care. The exam consists of two parts. So in order for you to become a CNA with the Headmaster exam, you would have to take a written exam. I looked at the current candidate bulletin at Headmaster.com, and it stated there are currently 72 multiple choice questions that you have to take. And whenever you perform your skills, you have to do 3 randomly assigned skills or clinical tasks. Plus, you have to wash your hands and participate in a multi-element skill such as hand washing and blood pressure. But again, if you want more information about the Headmaster test, you go to Hdmaster.com. So which states actually, let's see here. We have so many people saying that they passed their exams. I am so proud of you all. So looks like great one, Miss Eunice, Illinois. Yes, ma'am. We have lovely said that they passed their exam. I'm so proud of you. Jonathan passed his exam. I'm so proud of you. You all, we're going to help more people pass their exam. Letty passed her exam today. That is what I am talking about. You all make me so proud and so happy. So as of 2024, which of course is 2025, they may have more states, but these are all the states that utilize Headmaster as their examination credentialer. So we're going to get started shortly. We're going to learn. We're going to pass this test. And I just want to give this disclaimer. The practice test that we have today was created by myself, Eunice Mathis. I'm the owner of Florida Training Academy. I'm not affiliated with or endorsed by Headmaster, just FYI. I do these videos because I love to see my baby nurses, my CNAs, pass their examinations. And so, as I stated before, if you have any questions about, hey, what is actually on the Headmaster CNA examination, I need you to go to hdmaster.com. But until then, let's study this test. Let's study these questions. Let's learn terminology, and let's ace our test. All right. And so if you feel like you need more practice, don't forget on my personal website, which is nurseeunice.com, I have study guides. I have all types of resources to help you pass your test. You can even purchase a CNA study kit. That's right. You can have all the supplies for less than $50. All right, so let's get our pen and papers together, team. Find a quiet space so that you can focus. Read each question carefully and trust your instincts. You already have what it takes. You have the heart of a caregiver, and I know you're going to do well. And then we need to pray for Marilee. Marilee says her test is tomorrow, guys. Pray for her. And Naya, it is okay. Or Naya, you passed the skills exam. The written part is easy. Let's learn this terminology so the next time you go in, you will pass your test. Question number 1, team. A resident begins to choke while eating and cannot speak or cough. The nurse aide should do which of the following? Is it A, offer water to help the food pass? B, call the nurse and wait for help? C, pat the resident on the back? Or D, begin abdominal thrust immediately? They began to choke while eating, and they cannot speak or cough. And I love how encouraging you are to each other in the chats. That's what I'm talking about. That's that future nurse energy. And I'm going to be revealing the correct response in 3, 2, and that's right, everybody. If they cannot cough, if they cannot speak, it is a medical emergency. You're going to perform those abdominal thrusts, previously referred to as the Heimlich maneuver. If they can cough, you encourage them to cough. But in this case, the person could not cough or speak. So you have to jump into action while you're also screaming out for that nurse. Question number 2. A resident who is visually impaired requests assistance finding their call light. The CNA should A, tell them it's next to their pillow, B, place it in their hand and explain its function, C, ignore the request if the resident seems fine, D, turn on all the lights in the room. How do you assist a visually impaired resident or client? All right. Are you all able to hear me? Because we have one person saying that they cannot hear any sound. So if you can hear me, give me a thumbs up. All right. And yes, if you chose B, you are absolutely correct. All right. Question 3. Which vital sign change should be reported immediately? Thank you, Miss Lane. Thank you, Tanaka. Is it going to be A, an oral temperature of 98.9, B, a blood pressure of 120/80, C, a respiratory rate of 8 breaths per minute, or D, a pulse of 76 BPM, stands for beats per minute? So if it's respirations and you see BPM, that stands for breaths per minute. But if we're talking about the pulse, and you see BPM, that stands for beats, how many times the heart is pumping per minute. And I see so many correct responses coming through. So we'll be revealing the correct response in 3, 2, and yes, everybody, correct response is C. It's okay, Unicorn, if this always confuses you. So a respiratory rate of less than 12 would indicate that the patient is breathing slower than normal. You want to, of course, try to stimulate the patient, try to wake them up while you're calling for the nurse. So you have to know your normals as a CNA. If you don't know your normals, you won't be able to let the nurse know if something is abnormal. So make sure you study those vital signs. And if you look at the very bottom of the screen, you have our website, which is fltraining.com. You all, under our resources tab, we have a free vital sign study guide. So there's no reason for you not to know this information. You got to know it. You got to learn it so that you can become a safe caregiver. Question 4. When documenting care in the medical record, the CNA must A, use only red ink for accuracy, B, erase errors completely and rewrite, C, record observations objectively and in ink, or D, record observations subjectively and in ink. Let's see if you can get this one right. I have faith in you. I know you can do it. All right. I see so many correct responses coming through. I am so proud of you. Yes, everybody. It is C, baby. It needs to be factual. It needs to be objective. It needs to be what you saw, what the patient stated, not subjective, not what you felt. So, question 5. A resident with Alzheimer's begins to wonder, what is the best action for the CNA? A, lock the resident in their room. B, follow the resident and redirect them calmly. C, scold the resident to stop walking. Or D, restrain the resident in a wheelchair. Now, what do you know about Alzheimer's patients? What do they do all day? That's right. They wander, they walk. Your job is to make sure that they wander and walk safely. So the correct response is going to be exactly what you chose. It is B. That's right. So redirection preserves dignity and safety without using restraints. Question 6. When applying a gait belt to assist with ambulation, the CNA should A, fasten it snugly around the waist over clothing, B, apply it loosely over bulky clothing, C, place it under the resident's arms, or D, tie it in a double knot. And so that CNA kit that I was telling you about that we have available in our Amazon store, it includes a gait belt. You also practice these skills. And if you are having a hard time passing the written, okay to have an audio test where the computer will read the questions and the answers to you so that you understand the terminology. And so, everybody, I want you to pass your test regardless of what resources you use. And so, for question number 6, if you chose A, that's right. We're going to keep it snug. 2-finger check. Anytime you put something on the patient's body, whether it's a restraint, that ensures that there's enough room for circulation and blood flow. So if you knew that, give yourself applause. All right, question 7, you all. Which statement best describes standard precautions? A, used only for residents with visible signs of infection. B, required only when handling food. C, infection control practices used with all residents. Or D, applied only in isolation rooms. And you all, we have more people who are saying they can't hear us. I'm not sure what's happening, so I'm going to ask that they please sign out and join again, because obviously some of y'all can hear us because you gave us thumbs up. All right, so everybody, for question number 7, ding, 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 yes, standard precautions would be C. We're going to assume that all bodily fluids and blood is infectious and that we should treat all residents the same to prevent disease transmission. Question 8, which of the following is an example of a psychosocial need? Break those words up. Psychosocial. Would it be clean linens, nutritious meals, adequate hydration, or emotional support? All right. All right. I see you, Monka. I see you, Christine, Yvette, Danita. Yes, you got it right. Lois and Joseph. It is D. So, psychosocial needs involve mental, emotional, and social well-being. Question 9, and we're going all the way to 40 questions tonight, team. So question number 9, the CNA notices that the hands of a resident with Parkinson's disease are trembling during breakfast. What should the CNA do? A, ignore the tremors. B, offer assistance with feeding. C, take away the utensils. Or D, call the resident's family. And what I'm doing now is making sure you understand what are some of the common signs and symptoms with certain disease states. So we know that if a person has Alzheimer's, they should like to wander. Our job is to not tie them down, is for them to wander safely. And a person with Parkinson's disease, they have tremors. That's what they have. And so we need to encourage independence. So the answer is going to be B. So even though they are trembling, you're going to be patient and you're going to provide assistance to allow the resident to not only be able to feed themselves, but to maintain their dignity. Remember, if you try to do everything for them, you take away their independence, and sometimes your patients become angry at you because you're not letting them do anything. You're like trying to do everything for them. Or the opposite extreme is that they allow you to do everything and then they become more dependent upon you. And when the next CNA comes, she may not have that much time. So we want to keep them as independent as possible for as long as possible. Question 10. When feeding a resident who is sitting in bed, the bed should be at what angle? Is it A, any position the resident prefers, B, 30 degrees, C, 45 to 60 degrees, or D, 60 to 90 degrees? Revealing the correct response in 3, 2, and yes, it is D. And I'm seeing some new names. So, hey, new family members, it is D. So 60 to 90 degree angle helps to prevent aspiration while eating by allowing gravity to assist with the swallowing. So we're going to sit them up. And then after they get through eating, you all, we don't lay them back down because we're smarter than that. After they get through eating, what do? We can lower the bed a little bit. So maybe we'll take it to a reclining position about 45 degrees. But we do not lay anybody flat immediately after feeding because they can have acid reflux reflux. It's going to increase their chances of having aspiration. So give their food time to digest. 60 to 90 degrees while being fed. Take them back a little bit so that they're comfortable for about 30 minutes to give the food time to digest. And then after that, if they don't have any distress, any signs of aspiration, that is when you'd be able to lay them flat. Let's go to our next question, team. Hey. All right, so question number 11. Which of the following is the nurse aide's responsibility when caring for a resident with a urinary catheter? What's a urinary catheter? It's that thin, flexible tube that we the nurses insert through the urethra, and it drains the bladder. So if your patient has a catheter, you did not insert it, but you are responsible for doing one of these. Would it be A, reposition the catheter inside the bladder, B, clamp the catheter when the bag is full, C, keep the drainage bag below the level of the bladder, or D, disconnect the catheter for bathing? That's right, we have to give her a bath. We don't want her getting into the tub with a catheter. The answer is not D, you all. I was joking. All right. So if somebody has a catheter, they're not getting into a sit-down bath. They will probably have a sponge bath or they will be showered. So everybody, question 11, the correct response is going to be exactly what you have. It is C. You have to keep the drainage bag below the level of the bladder. That ensures proper drainage and reduces the risk of backflow, meaning urine going back into the bladder and infection. All right, you all. The sound you hear is my son coming in from playing soccer. So, son, shh, quiet. All right, question 12. A resident with Parkinson's disease is walking very slowly and has a shuffled gait. The CNA should A, encourage the resident to walk faster to improve circulation. B, walk behind the resident with the wheelchair in case of falls. C, tell the resident to sit down until physical therapy arrives. Or D, use gentle prompts and offer support with a gait belt. All right. Let's see what my team members have. I love working with you all. Thank you for working a shift tonight at Nurse Eunice's nursing home. I appreciate you. And so for question 12, if you chose D, you have it. Let's see. Parkinson's disease affects mobility and balance, so the CNA should provide gentle guidance and use a gait belt to ensure safety without rushing or discouraging independence. All right, question 13. Which of the following examples best shows the CNA respecting the resident's legal right to make choices? Would it be A, offering the same breakfast tray every day for consistency? B, allowing the resident to refuse a shower and offering alternatives? C, dressing the resident quickly to stay on schedule? D, explaining the rules and expecting full cooperation? Or E, none of the above? That was a lot. So I'll give you about 10 seconds for that one. Oh, we are torn between D's and B's. I can't believe I tricked you all. 5 more seconds, you all. Think about it. Which one shows that the CNA is respecting the resident's right to make choices? It would not be D, because we don't expect full cooperation. We don't own these patients. So that's right. If you chose B, you have it. So they get to participate in their care. They have the right to refuse care. And if your patient does not want a bath at noon, you would ask them when is another time that they would like a bath. When can you come back again? So the CNA should respect their choice and offer alternative times or options. Don't forget to document and don't forget to notify your nurse. Question 14. A resident with a new colostomy is embarrassed. What is the CNA's best response? A, avoid eye contact and complete care silently. B, tell them it's not a big deal. C, joke and lighten the mood. Or D, acknowledge their feelings and offer support. All right. And so when these patients have a new colostomy, They're going to have body image disturbances. This person was normal yesterday, and now they have a stoma. They have their intestine coming out of their skin with fecal matter coming out of it. So imagine how you would feel if you had a major life change overnight. And so, yes, you want to do D. Whenever we talk about communication, you as a CNA, is more about you listening than you talking. So acknowledge their feelings. That's going to help promote emotional well-being and trust. Question number 15. A resident repeatedly refuses to participate in group activity that they used to enjoy. What do you do as a CNA? Is it A, inform the activity director and document the change? B, try to persuade the resident to attend anyway? C, skip the resident's activities for the rest of the month? Or D, tell the nurse the resident is being non-compliant? And so this is more like a nursing home or a group home. This is not hospital level. Usually, if they're participating in a group activity, it could be bingo. And so Mrs. J used to love bingo, and now she's not going. What are you going to do? I see a lot of people saying that she's being non-compliant. You all, why would a person switch their behaviors, especially if they're elderly? If they used to enjoy something and now they don't do it anymore, what is that a sign of? Put it in the chat. It's not that she is being non-compliant. What's happening with her? That's right, Tanaka. You all, she may be depressed. So it isn't D that you're going to notify the nurse because she's being non-compliant. You can try to do B, but the correct response for this one is that activity director, you want to make them be aware, and you can also notify your nurse, because that change, if we actually pay attention, she's probably not eating or drinking as much either. So when they activities, they won't eat, they won't drink, which puts them at risk of being malnourished and also dehydrated. So do report it, but they're not being non-compliant, they're being human. All right, so the answer was A. Changes in mood or interest can signal depression or illness. Informing the activity director and documenting is the appropriate action. Question 16. Which action, besides repositioning every 2 hours, helps to prevent pressure ulcers in a bedridden resident? Is it A, massaging red or purple areas to stimulate blood flow? B, using baby powder to reduce moisture on all pressure points? C, tightly dry at all times? Of course, we know that we're going to turn our patients every 2 hours, but there are other things we can do in addition to frequent repositioning to decrease pressure sores. And what do you think, teams? Let's see what our team members say. We are torn between D's and C's. And you know what? You're both right. I didn't even catch C. That's right. We don't want our residents laying on wrinkles, but we most definitely don't want their skin wet. So D is the better option, but C, if you chose C, you weren't far behind. So I give you credit for that one too. That's why we say that you have to provide incontinent care promptly. We don't leave our residents wet. Wet skin, actually, wetness erodes the skin, and it can cause the skin to break down and lead to initially like a rash. And then a stage 1 would be the redness. It can start opening and blistering. That would be a stage 2. So clean your patients as soon as they have an episode of if they urinate or if they become wet. Question 17. If a CNA is unsure on how to perform a procedure, what should they do? A, guess and try their best. B, skip it until someone else can do it. C, ask the nurse for clarification. Or D, ask the resident how to do it. Hey, Miss Eunice, I don't know how to use your wheelchair. Will you show me how to use it? That would be a recipe for disaster. So that's right, Danica, Ebed, Danita, Fatmata, you have it right. Lois, Afua, hope I pronounced that correctly. It is C, y'all. Get that nurse to show you how to do it. Never perform a procedure that you're untrained or unsure about. And I know we want to trust our patients and we want to ask them for help, but the best person to ask for help is going to be that nurse, okay? All right, question 18. Before feeding a resident who has had a stroke, the CNA should A, check which side of the body is affected, B, place the resident in a reclining position, C, feed as quickly as possible, or D, offer large spoonfuls to save time. All right. I think some of you all are not on question 18 because of a delay, depending on what platform you're on. Because right now we're streaming on Facebook, YouTube, and probably another platform that I can't think of, LinkedIn. And so, question 18 is the response A, B, C, or D? And for everybody who is putting A, you are right. We need to know what side they had their stroke on, because if the left side of their body is affected and you put the food on the left side of their mouth, they're going to aspirate, or the food's just going to come right back out of their mouth because they're drooling. So you need to understand that deficits such as hemiplegia, one half of the body being paralyzed or weak, is going to cause aspiration if you put the food on the weak side. So make sure if you have a stroke patient, that you understand which is their weak side, and instead you want to utilize a spoon and feed them on the side that is not affected by the stroke. Question 19. The CNA is providing foot care to a diabetic resident. Which action is correct? A, clip the toenails with clippers. B, apply lotion between the toes to prevent dry skin. C, soak the feet in hot water. Or D, dry thoroughly between toes. All right, diabetics. Why is foot care important with diabetics? So once you give me the correct answer, I want you to tell me why we are so concerned about diabetic foot care. For everybody who chose D, your nurse just went, wow, your nurse is so proud of you. Now follow it up. Why are we so concerned about diabetic foot care? What is special about your diabetics and their feet? You never hear us talking about diabetic hand care, diabetic hair care. So what is so special about diabetic foot care, and why do we have to monitor their feet so carefully? Yo, T Young says takes injuries a long time to heal. That is right. Joseph said it prevents wounds, and Miss Bonita says it can cause an injury or an infection. So when those diabetic patients, whenever they have an injury, yes, they are slower to heal. They have poor circulation. So on top of that, they may not feel it if it's injured. Mercy, yay! That is right. So, everybody, I'm so proud of you all. Let's go to the next response. Take care of our diabetics and their feet. And even if they live in Florida, they're not supposed to wear flip-flops. They're supposed to have on good shoes. Question 19. The answer was D, which you all chose. Question 20. The most important reason to bathe a resident regularly is to A, remove germs and promote health. B, make them smell good. C, keep the skin dry. Or D, follow a routine. Right. Your patient didn't urinate on themselves. They didn't poop on themselves. And your nurse is like, hey, he gets a bath. If they're in like a residential type facility, he gets a bath every Monday, Wednesday, and Friday. Or they may have their shower days. And you're like, but he's clean. Why are we asking you to go bathe this resident who doesn't stink? And if you chose A, that's right. We need to remove those germs. Even though he doesn't stink today, those germs are still there. Believe me, I hate to be nasty, but when he passed gas, he let out a little something when he passed gas. So it could be a little wetness down there. We need you to bathe them up, okay? That's going to help them stay clean. It's going to also allow you to visualize their skin so you can notify the nurse if you see any breakdown, a rash, a bruise. So bathing is important. Question 20. 1. A resident refuses to eat the meal provided. I'm not eating that. What is the CNA's best response? A, notify the nurse immediately. B, try to force a few bites. C, ask why and offer an alternative if available. Or D, ignore the refusal and remove the tray. Well, if he don't want to eat, I'm just going to take the tray out. That's going to be him starving. Don't be that CNA. All right, so for question 21, team, what is the best response? We are torn between A's and C's. And so if you go out and you tell the nurse, hey, he refused to eat, the nurse is probably going to ask you, well, what did you do after he refused to eat? So we typically, if the patient's not violent, if they're not cursing you, trying to harm you, we don't accept the first refusal. We try to figure out their why. So the answer's going to be ding, 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 C. Why don't you want to eat? Because my stomach hurts right now. Maybe I will eat some soup if you have that. So exploring the reason and offering options supports resident autonomy, their right to make decisions about their health while also maintaining their nutritional status. Question 22. I forgot. You all know what I asked for. And so you all help a nurse out. If you've stayed this far, if you've stayed for this long and you haven't liked this video, shared this video, or subscribed to our channel, look, you all, we are 48,000 subscribers away from receiving our gold YouTube award. And so we do that because of people like you. So we appreciate your support. We come on here at least twice per week to help you pass your test. And all we ask for is a like, a share, and maybe a cup of coffee when you go to nurseeunice.com. All right, question 22. Which action demonstrates, hold up. Congratulations. You are so welcome. I'm so proud of you. Congratulations on passing your test. And then Andrea, thank you for the hearts. All right, so everybody, which action demonstrates the correct use of a mechanical lift, a Hoyer lift, during transfers? Would it be A, removing the sling once the resident is lifted off the bed? B, keeping the resident's arms free and legs crossed? C, locking the lift's wheels during the entire transfer? Or D, ensuring at least 2 trained staff members are present? Thea, Miss Lane, Rebecca, you all were fast with this one. Look, I don't care how short-staffed your facility is. You will never, ever, ever, ever transfer a patient in a lift, a mechanical lift by yourself, because you're going to go to jail. That patient may fall and the facility's going to say, we taught her better. She just was in a rush and she did it by herself. So one person actually keeps a hold of the patient who's in the lift, and the second one operates, it's like a crane. They operate the actual machine. So if you don't have help, you need to wait. The patient is safer in the bed than with you operating a lift all by yourself. Question 23. You are asked to assist with postmortem care after death, postmortem after death care. Which of the following actions is most appropriate? A, immediately remove the resident's dentures and discard them. B, close the eyes and mouth gently and position the body respectfully. C, leave all personal items on the body for the family to remove. Or D, delay care until the resident's roommate leaves the room. Yep. Some of your facilities still have semi-private rooms, which means it could be 2 people in the room. But what would you do? And this specifically refers to postmortem care after death care. So it wouldn't be D, because if a patient was actually dying in a room, more than likely we would not keep the roommate in that room. That would be traumatizing for that poor roommate. So the answer is not D, revealing the correct response in 3, 2, and that is right. It is going to be B, you all. Postmortem care includes positioning the body respectfully and preserving dignity. Dentures are usually reinserted, so we need to put those dentures back in their mouth before the rigor mortis sets in. And so, if you all don't know, the reason why we take the dentures out of the mouth during the code is if the patient needs to be intubated and the false teeth are in their mouth or their dentures are in their mouth, we can actually break off one of those and they end up in the patient's airway. So, usually in an emergency, we have to do something like bag or intubate. Dentures are out. If we could not resuscitate that patient, you have to then put those items back in. And so I want to go back and show you this. We have a full clinical video playlist on YouTube. You can access it from going to our website, and you'll see a tab, blue button up top to the right, that says clinical skills videos. But if you want to learn how to perform postmortem care, I have 2 videos on that. And yes, as a CNA, as a new CNA, you would be responsible for assisting and taking care of someone after they died. So it will be a good video for you to watch. Question 24. A resident suddenly complains of new leg pain, swelling, and warmth in one calf. What should the CNA do? A, massage the leg to improve circulation. B, assist the resident to walk it off slowly. C, elevate the leg and apply heat. Or D, report symptoms to the nurse immediately and avoid movement. Ouch, Mazan, my leg hurts and it's swollen. Will you massage it? That's right. The answer is absolutely no. We will not be massaging a painful calf. You're going to elevate it. You're going to limit movement, and you're going to get that nurse into the room, because those are signs of deep vein thrombosis or DVT. And if they travel, it could be life-threatening. The patient could stop breathing if it goes to their lungs. So movement should be avoided. The nurse should be notified, and then you will follow the nurse's direction from there. Question 25. A CNA should wear gloves when? And this one's tricky. Is it when you're making an unoccupied bed, when you're feeding a resident lunch, when you're performing perineal care, or when you're talking with a resident? And so regardless of which test you're taking, which of these is the most contaminating? That's how I want you to read this question. I should wear gloves when I'm performing the most contaminated skill. Because I know some of you are like, I want to wear gloves with everything. That's not going to be a response on your test. That is right. It is going to be C. C is the most contaminating. And when you're taking your CNA examination, check with your instructor. But for most of the feeding skills, gloves are not required. Clean hands are, but gloves are not. Now, if you're in a hospital, that means you have your CNA license already. You do whatever you need to do to protect yourself and to protect your patient. All right, so question 26. Which system is responsible for detecting pain, temperature, and pressure? So which body system? Is it the immune system, the integumentary system, the endocrine system, or the lymphatic system? This one's tricky, Anne-Marie. This one's tricky, Ebed. Miss Benita, this one's tricky. So everybody's giving me C. It's not C. Danita has it. She's the first one who put B. So think about it. When you're cooking in the kitchen and you touch that hot stove, ouch. Your skin detects pain, temperature, and if you lay on one side too long, it's going to be uncomfortable. You're going to feel uncomfortable. You're going to feel some pain. So everybody, B, the integumentary system we're referring to is the skin. So the skin contains sensory receptors that detect environmental changes like pain and temperature. Question 27. A resident is experiencing mild anxiety. Which action should the CNA try first? Is it A, encourage deep breathing and a quiet environment? B, suggest medication to the nurse? C, ask the resident to nap immediately? Or D, ignore it unless it becomes worse? Your patient's becoming anxious. They have mild anxiety. That's right. And so, how will we practice that? All right. So, Miss Lucas, it appears as if you're becoming more anxious. How are you feeling right now? I'm just so worried. All right, Miss Lucas, let's take some deep breaths in and out. Breathe like me. Let's take a deep breath in and release it. And then try to, just make the environment quiet. Maybe put on music instead of Maury Povich or something crazy on TV, but that will help decrease your patient's anxiety level. So great job, team. Question 28. A resident is found masturbating in their room. The CNA should A, yell at them to stop, B, report them for inappropriate behavior, C, close the door and provide privacy, or D, call their family immediately. Patient is masturbating. What are you going to do? That's right. You should have knocked to begin with. So, Nayo says, LOL. You all, these are adults and they have adult emotions and adult needs. Just because they're in your facilities, you don't own them. So the answer is going to be C. Masturbation is a normal behavior. So first of all, knock before you go into their room and give them an opportunity to say, come in. You're going to respect their privacy because they're paying for that room. It is theirs. And again, you don't own them. Plus, you don't want to see that. So give them time. Knock on the door before you enter the room. Question 29. A resident complains of constipation. What is an intervention within the CNA scope of practice? The LPN has a scope of practice, the RN has a scope of practice, and you, as a nursing assistant, have a scope of practice also. So are you able to do A, give a laxative, B, give a suppository, C, perform a digital rectal exam, or D, encourage fluids and increase fiber-rich foods if allowed? All right. I see all these correct answers. Somebody put C. I don't know who that person was. Don't do that. It is not C. The correct response is D, but I need to know more. Give me an example of a fiber-rich food. We're telling you to go do something. What are you going to pick from the pantry? I want you to imagine that anything that you put in that chat is available in the pantry or the refrigerator. Tell me one fiber-rich food. Man, Miss Benita, you just showing out, girl. We're going to give them some prunes. That is right. And we got prunes. We got oatmeal. You all are so freaking awesome. Apples. So yes, those answers are all correct. You should be so proud of yourselves. I'm proud of you. So it's going to be D. CNAs can promote hydration and offer high fiber meals per the care plan to support bowel regularity. Don't forget that if you just give them fiber, but you don't give them any water, you bulk up the stool, but the water helps flush out the bowel. So they need both. They need the prunes, the apples, the oatmeals. All that just sounds like you're going to be really regular, but also give them some water too. Question 30. What does incontinence mean, team? Is it A, the inability to hear, B, being incoherent, C, the inability to urinate, or D, the loss of bladder or bowel control? What does incontinence mean? Angelica, Darlene, Andrea, Rebecca, Mrs. Love, Child of God, you have it. So your patient can have urinary or fecal incontinence. So the answer is D. Incontinence is the loss of control over urination or defecation, aka fecal matter. And the CNAs often provide care related to this condition. Whenever you take your test, don't forget that a CNA does not insert a catheter. A CNA does not insert anything internal, so no suppositories, none of that. But what you do do is you take, that did not sound right, what you do. What skill you do perform is you would take your residents to the bathroom more frequently, or you would offer that bedpan more frequently. You all, I apologize for my Freudian slip right there. But question 31. Which behavior supports a resident's rights? I know, Tanaka. Would it be A, allowing a resident to refuse therapy, B, limiting phone calls to reduce noise, C, repositioning a resident only once per shift, or D, withholding meals for non-compliance? We have to support those residents' rights. They have rights. So which of those options helps to support and give them autonomy, allows them to make decisions for themselves so they feel like they're in control? And yes, this should be super easy for you all. It is A. And so whenever you are supporting your resident, hey, I hope you're still there. My computer just did something crazy again. Oh. Hey, I'm saying, hopefully y'all can still hear me. If you can hear me, give me a thumbs up. So it took me a while to actually get online because I was having Wi-Fi issues. And so I just want to make sure you all can still hear me. All right. I see everybody gave me the correct response. Can you still hear me? Thank you, thank you, thank you. So yes, it's A. Residents have the right to refuse treatment, including therapy and medication, but you can try to persuade them gently. Question 32. The first step in proper hand washing is, and a lot of you all get this wrong. So when you're taking your CNA exam, I'm going to hide this. I don't even want you looking at the question. When you're taking your CNA examination, the fastest way for you to fail your clinical skills is for you to mess up on hand washing. So when you're studying all those other skills, you should be practicing hand washing the way that your instructor taught you how to do so every day. And don't forget, we wash our hands before and after patient care. So for most of your skills, you're washing your hands twice. All right, with that being said, the first step in proper hand washing is A, wetting hands and wrists with warm water, or B, do you apply your soap first? C, dry with a paper towel first, or D, rub hands for 5 seconds. What's the first step whenever you are washing your hands? Especially when you have a nurse in front of you with a clipboard who's going to help determine whether or not you pass or fail your CNA skills test. That's right. All right, so it looks like Maka says you wet those hands first. So everybody, the answer is A. For those of you who are choosing B, apply soap first. Guess what happens when you wet your hands if you apply soap first? Your soap goes down the drain. So it's always wet hands first, apply soap second, and then 3, you start lathering, you start cleaning your hands. All right, so again, the correct response for that one would be A. And Ba Fatima said A. That is right, wet them first. Question 33. All right, so Claire wants to know who's learning from Uganda. Hey, welcome, Claire. I don't even know what time it is in Uganda. I'm in Florida. So everybody, if you want to put where you're viewing from in the chat, I think this is a good time to do so. But which term means difficulty swallowing? Is it dyspnea? Is it aspiration? Is it dysphagia? Or is it contracture? So I have multiple videos on medical terminology, multiple videos on prefixes and suffixes. So I need you to break those terms down. Which one means difficulty swallowing? What is the prefix for something that's painful or difficult? And Yvette's watching from Tampa. So everybody got it right. Oh my God, you all are awesome. It is C. That's right, because DYS in front of any medical term. Remember, if it's in the front, it's called a prefix. In the back, it's a suffix. So DYS stands for difficulty or with pain. So dysphagia, or excuse me, let me make sure I say it right. Dysphagia is difficulty swallowing, which increases the risk of aspiration. CNAs must monitor residents with this condition during meals. It differs from aspiration because aspiration is the medical term for when food or fluid accidentally go into the airway. It goes into the lungs. So let's go back and let's see where you all are watching from. Samuel, I don't speak. I think that is Creole, so I'm sorry. Thea's watching from New York. Nay Fitness is also watching from Brooklyn. Kay is watching from Ohio. Alpha from Afua from Canada. T Young is from Jacksonville. Duval, I hope it's Duval. Hope it's Jacksonville, Florida. We have somebody from Maine, Houston, Michigan. Oh my God, you all from all over. I love you and thank you for being with us. Question 34. The resident has an indwelling catheter. London. Oh my God. Yes, it's so. Samuel, why were you going to type that in Haitian Creole knowing I'm from Duval County? I'm from Jacksonville, Florida. I can't read that. All right. So the resident has an indwelling catheter. The CNA notices urine leaking around the tubing. So your patient who has a catheter is wet. What do you do? Is it A, reinsert the catheter, B, report the observation to the nurse, C, clamp the catheter, or D, increase the resident's fluid intake? Looks like Thea and sure no. I think that's sure no. Angelica, Morna, looks like Fatmata, Mavis. All right, so a lot of people say B, and you're absolutely correct. So if they have a catheter and it's leaking, maybe it's not draining properly. Maybe someone lifted the bag above the level of the bladder, which caused backflow. But after you make sure there's no kinks, you need to be reporting that to the nurse because any catheter complication must be reported for proper evaluation. Question 35. What does the term fecal impaction mean? Is it A, rash around the rectum, B, bleeding during a bowel movement, C, frequent loose stools, or D, hardened stools stuck in a rectum? And hopefully your patients never have a fecal impaction, because if they have a fecal impaction, that means that you nor the nurses were doing their job. You all, we have more than just vital signs. You go into the room, yes, you get the blood pressure, the pulse, the temperature, and respiration. You're also going to ask, hey, when's the last time you urinated? And how are your bowels? How's your pain? Those are just general questions you want to ask your patients every shift. And if that patient says that they haven't had a bowel movement in 1 or 2 days, usually 2 days is about the max. They haven't had a bowel movement, that means constipation. Fecal impaction means that it's so hard until we can't give them a laxative. We can't give them a suppository. They literally have a brick of crap in their colon. The nurse would have to put on gloves, lube up the fingers, try to manually with her fingers remove that hard stool. And if we can't get it out that way, the patient has to go to surgery. So ouch, 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 and ouch again. So don't forget your vital signs. After you get through doing those basic vital signs, ask about pain, ask about urination, and also ask about their previous bowel movement. All right, so question 35, of course, we know the answer is D. Question 36. Which term describes urinating at night? Is it nocturia, polyuria, anuria, or hematuria? Look at all those prefixes. Go, go, go. Do you know what those prefixes, what they mean? What poly means? What noct means? What a in front of a word means? What hema in front of a word means? And so for this one, if you chose, that's right, like an owl is nocturnal, they're awake at night. The term that describes urinating at night is going to be nocturia. It's going to be A. So it is the need to urinate frequently during the night, which can disturb sleep and leads to falls if not managed safely. So let's piggyback off of that one because you all did so well. A resident with nocturia gets up multiple times during the night to use the bathroom. What is the best action the CNA can take to promote safety? Is it A, turn off all lights in the room to encourage sleep? B, offer the bedpan every hour without asking? C, make sure the call light and night light are within reach? Or D, withhold fluids in the evening to reduce bathroom trips? And y'all, my fingers are crossed. Do not choose D. If you choose D, that is neglect, and you may be going to jail. We only restrict fluids with a physician's order. And so if you don't have a physician's order, you cannot treat these adults like they are your toddlers and start withholding their fluids. So I know you didn't choose D. Give me the best answer that's not D. All right, you all, you have it. It is going to be C. So residents with nocturia are at a higher risk of falls during nighttime bathroom trips. And a lot of your facilities have motion activated night lights where as soon as they move their foot or something, the lights under the bed, if they're not automatically on, they will come on. So ensuring the call light and night light are within reach helps the resident safely ask for assistance and navigate the room without tripping. What can you put at their bedside? If your patient's nocturia and they agree to it, what can you put at their bedside to make going to the bathroom easier at night and to reduce the risk of falls? Put it in the chat. Remember, our job is to be proactive. We see Miss Lucas getting up to the bathroom 3 or 4 times. Do we really want her walking all the way to the bathroom? What can we put at her bedside? Diana has it. We're going to put the bedside commode next to her. Yes, for safety. Great job, Diana. Question 38. A resident with dyspnea becomes short of breath after walking a short distance. What should the CNA do first? A, encourage the resident to walk faster to build endurance. B, instruct the resident to lie flat on the bed. C, call 911 immediately. Or D, help the resident sit down and rest. So, what does this patient have? They have dyspnea. Remember DRS in front of the word? That stands for difficulty. So this person already has difficulty breathing. Put it in the chat. What conditions cause difficulty breathing? Like, give me some lung conditions. Go ahead, put them in the chat. Because you don't have to call 911 unless the patient's like turning cyanotic or something. So what would be a reason that a person would be short of breath, but it would be normal for them to be short of breath? We have asthma. We have a lot of people who chose asthma, and then Nay chose COPD. That is right. So everybody, some people have chronic lung issues. Do D, give them a chance to sit down and to take deep breaths in and out. And if that doesn't improve or if they worsen, that is when you call 911 if you are in a home care setting. But if you're in a hospital, of course, you're going to press that code button or call for that nurse to get into the room. So the CNA should assist the resident to sit up in an upright position to rest and ease breathing. Sudden shortness of breath needs to be reported to the nurse, but emergency services are not called unless the condition is acute and life-threatening. And then Claire said heart failure. Vivian said heart failure. You all, oh my God, I'm so proud of you all. That is right. Remember, if the heart isn't pumping, those fluids are going to back up. So CHF does cause the person to have dyspnea also. Question 39. You notice that a resident's socks are leaving deep marks on their ankles and the feet appear swollen. My favorite CNA that I love working with, girl, we be having so much fun together on our 12-hour shift. What are you going to do? Are you going to do A, are you going to cut a slit in the socks? Are you going to do B, elevate the feet? Are you going to do C, ignore it unless the resident complains? Or are you going to do D, give the resident more salt to reduce swelling? And if you can see my little happy nurse tears over here, I'm so happy because you all make me happy because you're great caregivers. No one cut the socks. I know you wanted to, but that wasn't the right answer. All of you all elevated the feet. And don't give them salt. We know that fluid follows salt. So if they have a lot of salt, they're going to swell more. So swelling, aka edema, must be reported to the nurse. But while you're in the room before you can get me, you're going to make sure that the feet are elevated, especially if it's part of their care plan. CNAs cannot apply medical compression garments or alter the diet without direction. You all, we made it to the end. We're on question number 40. And you know, I am sad. I hate leaving y'all, but a sister got to get a nap at some point in her life. So question number 40, everybody. Which situation requires the CNA to complete an incident report? Is it going to be A, the resident's dentures are missing during morning care? B, a resident becomes confused about the date? C, a resident requests a different CNA for tomorrow. Ooh, she ain't like you. Or D, a resident's daughter brings outside food. So the videos are on our playlist. So all you got to do is if you're not, it looks like you're on YouTube. So all you have to do is you can save it by clicking the three dots, and usually be like save video or add the playlist. But we have a full playlist of CNA practice questions on our YouTube channel, and you can also access that from our main website, which is fltraining.com. So thank you for liking our videos and wanting to come back and watch it again. All right, everybody. So which one is so bad that we have to write it up? That's right. Hey, do not lose those people's dentures, y'all. Y'all don't lose their dentures. So if you go into a room and you can't find dentures, you can't find a hearing aid, we need to put everybody needs to be on the lookout. You check the trays, you check the gowns, you check the trash. Because if we cannot locate those dentures, your facility is responsible for replacing them. And they are super expensive. So lost or damaged personal items like dentures must be reported and documented in the incident report to remain accountability and transparency. But before it ever gets to the incident report, we're going to tear that building down. We're going to be looking for those dentures. We're calling dietary and making sure they don't, go on the trays. So as a good CNA, that's part of your job. When you go into that room, you should know whether or not your patients have hearing aids. And if you look and they don't have the hearing aids in their ears, hey, Miss Lucas, where are your hearing aids? They should be in the cup that's on the side of the bed. If not, you need to be searching those sheets, searching the gowns. Same thing for the dentures. Make sure that whatever your patient was admitted with in that hospital facility, that at the time of discharge, they actually have those items. I love you all. I want you to remember that caring CNAs become caring nurses. And so you're taking a right path, whether it's CNA to RN or CNA to LPN and then RN. The fact that you're learning terminology, you're learning how to communicate, you're learning how to do all those skills, it is so vitally important. And your patients are going to love you for doing the baby steps, for doing what they sometimes don't appreciate, the grunt work. But it's going to make you a better nurse, and we appreciate you as a caregiver. Don't forget, there's our YouTube channel. It is the first link. We have our website. If you go to nurseeunice.com, which is my personal channel, my personal website, you can also get free study guides, etc. Go down to the very bottom. I just did a phlebotomy study guide this weekend. It's down there at the bottom somewhere. I have a lot of free resources for you, but I love you and I appreciate you. And I am so thankful that you watched this video, that you stayed all the way to the end. So I'm going to give you a good old nurse hug. There's our nurse hug. Let's huddle. And so I know that Nurse Jackie will be on Monday. I have a full weekend, so I probably won't see or be back online until next Wednesday, same time, same place. But I'll make sure I have my camera on next Wednesday. As I do in every video, I will stay around for a few more minutes and just review the messages in the chat area. And until next time, everybody, be blessed, keep being awesome caregivers, and don't forget self-care because you matter too. Bye, everybody.